Oh, welcome back to the morning show here on Arise News. I'm Biola Labi. Adeola Sabia and Jife Williams are both public health experts and co-founders of MN Environmental Service, a facility management company established in 2008, an affiliate of Metamorphosis Nigeria, a non-governmental organization established in the year 2000 to promote safe sanitary and hygiene practices through education and training. MN is actively involved in the provision of solutions to sanitation and hygiene issues facing the public sector through collaborations with Lagos State government. Both of these thoroughbred professionals boast of experience in banking and diverse corporate interest, as well as management. They've also won several awards in recognition of their work. Adeola and Jife, thank you so much for being on the show today.
Thank you so much for having us.
So one of the things we talked about was, a couple of weeks ago, actually this started, we were talking about the open defecation problem in Nigeria and the challenges and what it poses to people. One of the things people don't know is that there are direct health consequences of this, but there are also huge financial issues around this. First of all, tell us a little bit about what MN does and why you do what you do.
MN Environmental Services was established really to solve a social problem. We see ourselves as social entrepreneurs, and the problem that we're trying to solve is open defecation. So MN Environmental Services basically is trying to scale up the provision of access to public toilets that are well-maintained in high-density locations so that we can have a maximum social impact. Just to try to change people's experiences. You find that a lot of people, go out and they really don't have anywhere to go. And so you see people doing it in the gutters, on the main road, in the bushes. And there's a term called flying toilets, which means that people do their business in black nylon bags. And they throw it over the lagoon, just places where, they shouldn't be doing it.
Jife, when we were reading about this, it was actually a headline in the paper, this open defecation. That's why we just became very passionate about this issue and wanted to continue to talk about this issue, about the health implications, but also about the financial implications. One of the stories that struck me in that headline was that there was a gentleman who said that he drives a taxi and there's nowhere for him to use the toilet. So what he does is use the toilet in his taxi and then throws it out when he's done, which is, I guess, this flying toilet you hear. When you guys began this process of going into this business, what were some of the most shocking things you found out about open defecation in Nigeria?
Yes, when we first started MN Environmental Services, we started with a project in Obalende community, and that project was to mobilize residents in Obalende to clean their streets on a to clean their streets on a weekly basis. They clean their streets and their gutters. And it was during that period we found that there was a deficit in the availability of toilets for residents in the community. And one of the challenges that was pointed out to us is that many of the residents in a community like Obalende, they live in a one-room accommodation, so they have to share services. So you can imagine when you have to go to work in the morning and there's a long line of people waiting to use one toilet, one bathroom, and nature calls. What do you do? And we found that that was one of the reasons why people practice open defecation, because there's no access to available toilets.
What is the deficit currently in Nigeria when it comes to access to toilets? What is the deficit of toilets?
Well, there's a recent publication that said that 46.5 million people in Nigeria are practicing open defecation today.
46.5. I think Nigeria has the second worst record after India.
Yes, definitely. And I think that record, we used to be number 5, I believe, 5 years ago, and we've dropped up to number 2 in the world.
Is that because our population growth, or is it just because we're not even catering to it? We're just, the current toilets we have are also degenerating. How did we get to that number?
I think it could be a combination of all of these factors, growing population.
And then obviously other countries also responding to their own needs.
Yeah. And I think also we are not, it doesn't appear that we are addressing the issue of poor sanitation by providing access. And what we found out from my experience in Lagos is that where toilets do exist, you know, it's okay for the first 6 months. And because maintenance is an issue, after the first 6 months, nobody pays attention to the toilets. Money is not going back into maintaining, upgrading the fittings, correcting broken pieces. Then it goes back to a situation of disrepair.
I mean, you're telling me about your Lagos, your collaboration with Lagos. One of the things I keep getting a sense of is that there's not a sense of urgency in Nigeria. There's not a sense of panic about this in Nigeria. One of the things that I saw in India last year, we also showed a major blockbuster film that was all about open defecation, which I think a big chunk of that funding for that film was actually from the government. What do we need to do in Nigeria to create a sense of urgency, the fact that 46.5 million people don't have a place to use the toilet?
Biola, first of all, I want to just also say that this is a governance issue. You know, we didn't meet up with the Millennium Development Goals. You know, there was a Millennium...
Yes.
I think that Goal 7 said that we needed to reduce by half the amount of people who do not have access to basic sanitation. And sadly to say that Nigeria failed. We have not met up with the Millennium Development Goals, with Goal 7. It's a burning issue and has been for a long time. But because, and I'm going back to the governance issue as well, if government sees it as a priority, then they would use their political will to do what is needed. We need UNICEF, there was a UNICEF report that said that we needed to build 8 million public toilets across the 774 local government areas in Nigeria. That was if we were to meet up with the Millennium Development Goals. So you can imagine how much more. You know, we're dealing with population explosion, but we're really dealing with governance issues that they have not and refuse to address the issue.
So how can you make a difference in this whole, this is a grave problem. How are you making a difference? What is MN Environment doing?
So MN Environmental Services, we are providing toilets in motor parks and bus stations. But I'll go back to the Obalende example I gave. So during our work in Obalende, we found out that there was a deficit in the provision of toilets in the area. We mobilized the community, and with support from a private sector organization, we actually put a facility in the Obalende Motor Park, which was under the T&M Transport Organization. Now, when we first started the toilets, at commencement, we had about 60 people using the toilets on a daily basis. And that grew to 600 people daily. So it confirms that there's a need, and it also confirms that where you provide access, people would use it. The facilities were not run for free. It was offered on a pay-and-use basis. And what we found at MN is that there was a high willingness to pay. Where you come to a facility which is clean, surrounded by a number of people, we are providing a service. People were willing to pay. And the same Nigerians who we're serving, because people always say that we're too poor, that nobody would pay for a public service. But what we found, that people were always ready to pay for a good service, and they even went a step further by tipping the workers because they were just so relieved to have a place to go.
So it's a dignity issue as well.
Yes.
People aren't willing to pay a little bit for their own dignity.
Yes, very much so. And I think that's one of the things that we want government to see. It's not just about providing public toilets for people to go and use the toilet. It's about dignity. It's about giving people a sense of being, that if they should go out, they would have access. Like in developed countries, you know, there's access to public toilets that are properly maintained. It's about a quality of life. It's about, you know, reducing people's blood pressure, you know, and anxiety that when they go out on the road, they're sure that they'll find somewhere to go.
Let's talk about a little bit about why this is so important, and talk about some of the diseases and some of the illnesses because we don't have public toilets we are at risk of? Not just the 46 million, but all of us are at risk of these diseases. Talk a little bit about that.
Well, you remember the Ebola crisis.
Yes.
And one of the things that was ringing in our head was that, goodness gracious me, see what we've been saved by. Because if you look at public toilets, they're no-go areas. People, actually, the ones that do exist, some of them are no-go areas. They're dirty, they're, have sanitation problems, you could get diseases, from it. We use it as a platform to promote safe sanitary and hygiene practices. And what I mean by that is if you should come to the facilities that we run, we would get the hygiene officers. We don't call them cleaners, we call them hygiene officers. And typically, if anybody comes to use the toilet, they would ask them to wash their hands with soap and water. Because, interestingly enough, a lot of people come and don't even think of washing their hands. So we're dealing with people from all walks of life. And so we use that as a platform to tell them, if you don't wash your hands, because some of them will say, why are you teaching me at my age? And they've been trained to politely tell them, for instance, that you can reduce diarrhea by 40% just by this singular act of washing your hands with soap and water. Like I said, the Ebola crisis was one. I mean, you can get all sorts of
we have cholera,
yes.
we have,
typhoid.
Sort of typhoid. All these diseases are part of that. And one of the things that this report also said, besides the 47 point, was that about 455 billion naira is lost annually because of the fact that we don't have public toilets to, I guess, sicknesses and deaths, and actually even going back to clean those places. What is your plan? What is your expansion plan? How are you going to reach these over 700 local governments? How are you raising money to do this?
Well, that is actually one of the reasons why we're here today. Because
it's always going to be about money. Yes.
We want to first of all thank Arise TV for having us and giving us this platform.
This is a very urgent issue.
The last speaker, one of the last speakers, was talking about how Nigeria used to be so dirty, but it's cleaner now, and we beg to differ that we do have a lot of problems. Our sanitation is just a segment of the whole issue of dirty environments. Yes. And funding is an issue, and that's why we haven't been able to scale up. Jife talked about the facility in Obalende. We were working with SNEPCO on that shell, but unfortunately for us, the corporate responsibility is such that when we do build a toilet, then they need to give it to the community. Now, we found that that's been a problem, because if you go back, 2 years later, you see that they don't know
what to do.
Yeah, they're in disrepair. And so we stopped working with organizations like that and decided to go into the driver's seat. And we built a facility through funding. But what we see here is that there's a need for the government and the private sector to collaborate on this, because the government will provide the enabling environment, but the private sector, and believe me, there are many organizations who are ready, willing and able to fund public toilets. If government would give them the enabling environment and work with them under PPP, because that's the model that we worked with when we're working with SNEPCO. So funding is not an issue for the private sector.
So SNEPCO was Lagos State, Shell, and you?
Yes, it was, Ministry of Environment, our organization, and SNEPCO under that umbrella.
But the Ministry of Environment has a mission and a goal, which they did announce, to end open defecation in Nigeria. Do they have funding for that? Are they supporting that with funding? What's happening with the Ministry of Environment in this goal? Jife?
Well, I'm not quite sure. I can't speak to what the Ministry of Environment is doing, but I know that an arm of the ministry, the Central Business District, they had built a few facilities on Lagos Island. They built 5 facilities, which is supposed to be addressing the problem of poor access to adequate sanitation. And MN Environmental Services, they recognized the work we're doing, and they gave us 1 facility in the CMS bus park. And to speak to that and to confirm that there's a need for public toilets and there's a willingness to pay, when we started that facility, started operating it 2 years ago, we had about 100 people using it on a daily basis. And that grew to 600 people on a daily basis. And in a month, that's 6,000 people using the facility. In a year, that adds up to 108,000 people. So there's a need for it, but we need support. MN Environmental Services cannot do it alone. The government cannot do it alone. Private sector cannot do it alone. We all need to come together. There's a need for partnerships. Government would provide the enabling environment. The private sector would hopefully provide funding, and we would be coming with the expertise and the passion which we have for this sector.
And then to transition it into sort of an impact-based business so people can pay to use it. Today, how many public toilets do you run, and in what places do you run them? Okay. So you have the Obalende and the
Well,
CMS.
we don't have the Obalende anymore because what happened was that was a Shell project, and so we had to hand it over to the community. In fact, Shell built through us, but we had to hand it over to the community. We have one along Anthony Taxi Park.
Okay. So it seems to be you're targeting these motor parks because, is it because of the sheer number of people that touch base there every day?
Yeah, that's part of the business plan because our focus is on high densely populated areas because first and foremost, we want to have a high impact. So apart from the one in Anthony Taxi Park, we're also managing for Lagos State. So we're working in partnership with Lagos Central Business District to manage a facility for them in CMS. And we're also working with LAMATA, Lagos State Metropolitan Transport Authority. We have a service contract with them to manage the public toilets in Ojodu Berger.
Okay.
And so for us, multi-sectoral collaboration is really what we're all about. We can.
Is this Lagos, your Lagos partnership, is it a model for other states? And if that is, tell us more about that Lagos model and how you can scale it for other states, if other states are listening so they can call you.
Well, I mean, it works under a public-private partnership agreement. So they provide the land, or if they have facilities, because some do, we will enter into a management contract to manage the facility. We will staff it. We will equip it on a daily basis and, cleaning the facility. But we typically have to pay some kind of a contractual fee to Lagos State for running the toilets.
Oh, you have to pay them?
Yes.
Okay.
Yes. So right now, the contracts that we have been on a 2-yearly basis.
Okay.
But, we'd like to extend it because right now, one of the problems that we're facing is that one of the facilities that we're managing has actually run its tenure. But they would like us to come back. But unfortunately, we have some political issues with that. I won't mention which agency it is.
Okay.
But one of the challenges is that when they do work with private organizations like us who have the skill and the capacity, you have the politicians who are card-carrying members, and for some reason they want to run public toilets. They have no idea about the expertise, but because it's on a pay-and-use basis, all they see is, oh, we can make money out of this. And unfortunately, it's not it's not just a money-making business.
Well, it's a business you're running.
It's a business, but primarily it's a service that we're providing to the Nigerian people. That when they come to a facility, it should be like a home away from home experience. The way LAMATA is trying to improve journey times, we're also trying to improve their experience while they're going out, the mobile population. So we're not just looking at the money. And unfortunately, we have a tussle. We're in competition with the politicians who want to run the toilets, instead of government giving it to organizations who have the capacity to manage.
Biola, if I may comment, in addition to what Diola has said, apart from partnerships, facility management agreements with government, what MN also does is get government to give us land approvals to build facilities. So we provide the facilities and we manage them over a period. Under that arrangement, MN would access public funding from private organizations, donor agencies, to ensure that we can implement that project. I feel that because of the struggles we've had, Diola and I have been in this business for 18 years. Are we where we would like to be? We're not. We'd like to scale up, but we've had challenges getting land approvals, and that was one of the reasons why we tweaked our business model to begin to work in partnerships with government. So if government is building facilities, what we are saying is we have the expertise, we have the commitment, we have the passion. We'd like to partner with them to provide facilities management on the one hand, and on the second hand, what we do, we use our facilities as a platform to bring hygiene education. I've told you the numbers from CMS, the numbers from Obalende.
Yes.
So if we have 10, 20 of these facilities around Lagos, and we are reaching out to 100,000 people every year, before you know it, the message will go from household to household and will begin to change the conversation in Lagos.
Wow. I have to say, you know, just sort of as a last call out to people at home, to people that could probably support your work, how can people get involved in supporting your work, and what type of support can people give you for your work?
Well, we'd like funding, more funding.
So this is almost sort of like is it sort of a CSR type of funding or investment type of funding?
We'd like CSR or investment funding. Because what happens is that when we go to the government and say, look, we need to build more public toilets, they will say, oh, we don't have money. Because they have other issues that they have prioritized over sanitation. You know, there's a lot of focus on water. Sanitation has always been like the poor cousin. You know, it's forgotten, it's left behind. So if we could have organizations who are interested in partnering with us and government, so that it's a...
So you're looking for investment, you're looking for partnerships, you're looking for donor funding.
Exactly.
Anything else out there that you're looking for?
We're also looking for a government who recognizes their shortcomings and wants to address the issue, because it goes beyond just providing public toilets. As we said, it's about dignity. And, you know, if they have a vision, it could actually also include poverty alleviation. Because can you imagine having all of these public toilets in the 774 local government areas? We employ hygiene officers who are cleaners. We employ supervisors. We employ ticket collectors.
So you're creating jobs as well.
We're creating jobs as well. And, you know, because it's public toilets, it's always liable to disrepair on a daily basis. So we're also engaging artisans, electricians, plumbers who are attached to the facility, you know, to repair whatever is broken.
I have to say, I think you guys are doing God's work. Thank you so much for being here today. Thank you so much. And anything else, Jafet? Looks like you were saying something.
No, just to say thank you so much for having us.
It's a pleasure.
We've enjoyed being here.
Thank you. It's a pleasure. We look forward to having you again and reporting back on some of the progress you're making. This is an urgent issue that we all need to be facing in Nigeria. Thank you.
Thank you so much, Biola.
Thank you. It's time now for a break. When we come back, our Rise News analyst and producer Charles Ohaku will be joining us to review the top newspapers' headlines from around the country. Stay with us.